Ted, I've known you primarily in your capacity with Rayus, but tell me a little bit about how you got to where you are now. Where did you start?
I started out life professionally as a chiropractor.
And you went to Parker.
I went to Parker in Texas.
Great school.
It was a good school.
Yeah.
Very good education.
Yeah.
Really enjoyed my time there. Practiced for about 10 years. As I practiced, I came to a realization that I wasn't happy with imaging resources for patients. I would send patients out for imaging, and I wasn't happy with what I call the product, meaning the reports seemed vague. They weren't detailed. Their experience in the imaging centers they went to, which are typically hospitals at the time, in the early 2000s, their experience wasn't great. They weren't treated well. So I wanted to do something different. I had this idea. I'm like, I could do this better. And I felt like at the time, since I was a practicing chiropractor, I felt like the chiropractic community also needed that. They needed to have this connection to imaging that they just didn't have. MDs had better resources because they were in the hospitals, etc. They were connected, but the chiropractors were not. So I actually started borrowing machines from imaging centers locally. I connected with a fantastic radiologist at the time, and we started borrowing time on MRIs from facilities. And what happened was we became so popular that full days at these imaging centers were all ours. And it became apparent to me that I had to get my own machine. And so actually 17 years ago, we built the first one across the street from here. And I still have that machine I named her Betty. She's very dear to me. We've upgraded her multiple times, so she's, technology-wise, she's right there where she should be. But first machine, and it was a wild ride because it was in those days there weren't a lot of independent imaging centers, and I felt like we really made our path with it and created something that was very unique. And we created a following because what we did is we really concentrated on quality and patient experience. It was so important to us. We wanted patients coming there not feeling like they were going into a into a dreary place. We built our center really big and open so that they didn't feel claustrophobic. So I think we did a really great job, and we grew from there. We grew from 1 to 5 centers. Our name was USMRI at the time. We started connecting with sports teams, again, because our product, our imaging, our quality, our patient experience became very popular. Athletic teams from around the country started noticing what we were doing. So we were seeing athletes from, honestly, all over the world. International athletes would fly here. They'd be connected to a physician, and they would come here to get their imaging. Because, again, I think our product was so good. Our radiologists were so good. And I think we just created a great product. And then from there, after we grew to a certain point, imaging is such a strong technology field, meaning that it's consistently growing, and we had talked about this earlier, but exponentially fast. Every year, even more so. I mean, if I rewound the clock 10 years, it wasn't growing as fast 10 years ago. 5 years ago, much faster. Now, consistently very, very fast. And that's due in part to AI. AI is playing a big part in imaging right now, especially over the last 1 to 2 years. So Rayus came along. They were a great resource for us. The way I looked at it was that we needed to merge with a company that had more resources so that we could stay ahead of technology, so that we could continue to have really, really high quality. We were already dialed in on the patient experience part, but the quality part was important to me. We wanted to make sure we didn't get behind. And it's difficult in this field now to not get behind. But I think we've done a great job of always staying ahead. Always staying ahead in the technology. We just put in a new MRI last year that you could call the latest and greatest, that is very AI driven. And it's, a very powerful MRI machine, one of the most powerful in Utah. And the time factor is incredible because MRIs take a while to do. This one is extremely fast because AI helps it render images that much quicker. But the incredible thing is you can also, if you give up a little time, you can actually make the image quality so incredibly high that it's almost unbelievable when you see it. Because you're like, years ago you could never have created such a detailed image from an MRI, and already, I see that growing again because AI improves so much of that. In a year or two it will be even better, which is exciting. It's an exciting thing.
One thing that kind of made me think in that story is the field of chiropractic and the larger, more general field of medicine have historically been somewhat disconnected from each other.
Yeah.
And the story of chiropractic coming and merging with medicine and being included as a part of that community is the story around imaging.
Yeah.
Because imaging was exclusive to hospitals, and you've taken that and made it available to all patients and all providers, which I think is so incredibly valuable.
Yeah.
And it's brought in this whole additional group of people that can now participate in improving outcomes. Yeah. And it's impressive that you kind of pioneered that, and more people are seeing that as such a valuable thing.
Yeah, and it's really fun to watch, and you probably are experiencing this too, but just in the last 1 to 2 years, we work so much more with physical therapists because now they have the ability to order imaging. Yep. And it's just wonderful to see how it's enhanced their practices and their outcomes with patients. But again, we talk about this all the time in our practice, but that the physical therapists now are becoming so astute at looking at images, learning what to order, and then incorporating it into their practice.
And I love that because I think that you really get a better sense of what's going on with a patient when you spend time with them, gathering history and doing a physical exam, understanding their concerns, where their symptoms are, reviewing the images, which are increasingly good and increasingly giving you that picture, and then managing and carrying them through treatment and revisiting history and physical imaging along the way, and you start to put that together. And I think it helps clinicians in all fields become increasingly good at what they do. Yeah. Because they're seeing the three-dimensional picture of what's going on.
Yeah. Yeah. Yeah, it's really great to take an image and then marry it to the clinical picture and like put the two together, right? And you spoke about this, but like once you have an image and your diagnosis then becomes real, and you connect it to that clinical diagnosis, it's almost perfect, right? I mean, you feel very accomplished at like, I can treat this, or I can figure this out. And yeah, that's what makes imaging so amazing, is it's such a valuable tool, right? I mean, it's incredible what you can see.
The other thing that you mentioned that I love is this focus on quality, because it's harder and harder, I think, in clinical medicine to have that be your focus. It feels like there's just never an end to the amount of work that's required. We were talking with one of the physicians that's expanded his practice a little bit, and at the end of clinic he had 40 messages to answer. Yeah. How do you think, continue to make quality our enduring focus?
As far as imaging goes, or just in general?
Imaging, or in the quality of the care we provide, or both. Because there's a lot of competition in your market, there's competition in ours, and there's some overlap there, of course, but how do we continuously make quality the number one driving focus in what we do?
Yeah, it's one of those things where it's almost like you can't give in to this I mean, there's a movement in medicine, unfortunately, because time is a factor, right? And so anytime you give up time, you tend to give up quality. So do you give up the time, you know what, to see more patients, to do more scans? You absolutely can. But then once you give up the quality, then I think you're just losing something. And that's, unfortunately, medicine is moving that direction in a lot of places, and it's again unfortunate. But I just think the only way you keep the quality piece is you just don't give up that time. Like, right? You have to stay there, stay where you're at. I mean, you're popular. A lot of people want to see you. There's only so many people you can see in a day, right? And you probably struggle with that too, all the time.
All the time.
Yeah.
We were actually talking about in our morning meeting this morning with my team, like we were talking about wait times, and I can't go and build 5 more of myself. And so that's tough. But just an enduring focus on quality, I think, is what we all need to do. And you've done it, and I've seen it over the last several years, how it has allowed you and your team and the environment to flourish by making quality the focus and not getting distracted by increasing volume or trying to just expand and be bigger.
Yeah.
So way to go.
Yeah, thanks. Yeah, it is. It's my first center I built. I kept it a single center for 6-7 years because I wanted to perfect that single center. Until I felt like it worked exactly the way I wanted, I didn't want to replicate it. But once you replicate, it gets a little easier to keep your model. But I will tell you, the more you replicate, you continue to do it, that quality piece is always a struggle. You're always working for it because it's more people, it's more volume, it's more centers. It's just like if you had 10 clinics, right? 10 different places, it gets difficult. And you hire more physicians, and that helps you, but you're still always trying to struggle with that quality piece because you want them to work the way you want them to work.